How are you?
I am good. How are
I
you?
am good. Thank you for joining me today.
Absolutely.
All right. Thank you, everyone. Hi, Zanetta. I'm waving at you. And hi, Eliza. How are you doing? So thank you, everybody, for joining us today. This is Uncommon Knowledge with Dr. Durwide from Data Gynecology, where we make uncommon knowledge common. And if you are in the Chicagoland area, you're looking for a gynecologist, I'm your girl. My office is in Homewood, Flossmoor, Illinois, in the south suburban area of Chicago. A lot of people think it's south side of Chicago. No, I'm in the suburbs, south suburbs of Chicago, so near Olin Park, Tinley Park, all those areas. Okay? Frankfurt, stuff like that. So if you need a gynecologist and you're in that area, come on in. I'm taking new patients, okay? All right, today I'm excited because I have Dr. Sarah Neitzel.
Hello.
She's from Western Washington.
Mhm.
She's a board certified podiatric surgeon, so foot doctor, foot surgeon.
Yep.
She's the CEO of Peninsula Podiatry and the founder CEO of Pure Peninsula Spa, which is a mani-pedi spa.
Yes.
Is that correct?
Yes,
Yes.
it is.
She's been in private practice for about 8 years, and now she has added on another hat to her business. She's a physician coach.
Mhm.
She coaches physicians on how to start their own private practices. And guess what? I'm one of her students. And she does this through her coaching consulting firm called Visionary Practice Solutions. All right, so her private practice specializes in minimally invasive surgery, regenerative non-surgical therapies, and toenail fungal laser therapy. There's laser therapy for toenail fungus, you guys.
There
That's
is,
awesome.
and it works.
Oh, that's awesome. And when she's not working, guess what Dr. Nietzel is doing? She has a small farm with her husband, which keeps her plenty busy. And after this Instagram Live, she's getting on the farm. So
I am.
she's,
Yeah. I got work to do.
that's awesome. That's awesome. So very versatile physician with us today. And our topic today is tips on how to have a safe pedicure.
Yeah.
So I get pedicures all the time. I get manicures all the time. So to have a physician who specializes in nail care, who has her own mani-pedi spa, I was like, let me jump on this. So I can, because I know all my ladies come in, all my patients come in with their nails done and their foot done. So we want to make sure that while we're doing all those things, you're keeping yourself safe.
Yeah.
All right.
Yeah.
Let's get into it, Dr. Sarah.
Yeah.
All right.
Well, thank you.
Absolutely, absolutely. Anything you want to add to the bio? Anything you want to add to the bio?
No, I think you covered it great.
Perfect. All right, so give us your tips. How do we have a safe pedicure?
Okay, well, like just so everybody knows, I started this because I was constantly seeing people come in to my office in my private practice with foot infections and especially like fungal infections after getting a pedicure.
Oh, wow.
And, you know, I'm one that likes to get pedicures too. I would get them regularly. And unfortunately, like I kind of knew when things weren't so clean and like I kind of knew I was rolling the dice, but it feels so good. So I figured like, okay, well, why can't podiatry have, you know, like mani-pedi spas? That like a logical extension for a business. Yeah. So, you know, over the last like 3 years that I've had the spa, I've really kind of put together, you know, a compilation of some tips and stuff for people. So like, honestly, I think pedicures are great for people. I think we do have to be kind of careful and judicious about where we go. And I think there's some things to look for. So the first one is going to be like the overall cleanliness and like organization of how everything is set up. You want to make sure that like, you know, the tools are kept separate, you know, from the disposable items. You want to make sure that, you know, people are wearing gloves and just kind of some basic cleanliness things. The second biggest thing, though, honestly, is the treatment of the tools. So like all of the little tools that, you know, they kind of dig under the nails with, or where they're like clipping the cuticles down, things like that. You want to make sure those are actually being sterilized. And there is unfortunately a lot of variation amongst places with like the requirements for cleanliness, right? So I've seen everything from using just a cold sterilization solution, it's kind of like a pink solution that they'll drop stuff in, to like sticking it under these little UV lights. And I gotta tell you, like, that does nothing for fungus. Like, it's not gonna get rid of it.
Wow.
And fungus lives everywhere, right? So like we all have it on our feet. The issue with going to somewhere where you have multiple people's feet exposed to the same tools where it's not being cleaned properly is now you're getting other people's fungus, and your body's not, your body's not super good at getting rid of that. So, sometimes you'll see sterilization bags that look like something you would like have popped open. I have seen places where like they just have the tools in the sterilization bags, and you can see that the little dark indicators, like the bag was never sealed, the indicators are not dark, like we know it wasn't actually sterilized, right? But for general layman purposes, you're not going to know that. So, be careful to make sure that the sterilization bag is actually been sealed, and you can ask to see the markers on it to know if it actually went through an autoclave. Really, I think that's the best way to do it. That's what we do in my spa is I just have an autoclave that we use, and it's the exact same autoclave that we would use for like our surgical tools for my in-office procedures. So that is as clean as that's going to get, because if you can use it in surgery, you can definitely use it in the pedicure. The other thing,
sometimes you just have to make sure that when they're opening up that bag that it's being opened for the first time. Yeah. It's not like it's been opened. Yeah. Okay. Yeah. That's what I mean. That it was sealed. Yeah, make sure it was sealed and not just like dumped out. And then the other thing is going to be the single-use items. So anything other than like the hard metal tools, realistically, in my opinion, should be a single-use item. So any of your nail files, your buffers, your pumice stone, those should all be things that are fresh for you and then thrown away. If anybody's pulling anything out of their apron or pocket, you can pretty well guarantee it's probably been used on somebody else. So that's a no-go. Okay. And then I think, the safety of some of that equipment is important also. So one of the things with calluses is that people will tend to use like those little electric tools on it. Those can be okay in terms of cleanliness as long as they're putting a new buffer or a new piece on there. I don't know if you've seen those or not, like the little electric buffers. But I don't remember them ever switching out the head for a new one.
Right. So that's number one, like make sure the head's getting switched out. But even if it is getting switched out, that can be kind of an aggressive tool. So, if it's not used properly, or if you're a little older and your skin's a little thinner, like that could actually cut you up, The cheese grater type of situation, those are very easy to clean if they're clean, but they're super aggressive. And so like that's probably the one that I see the most foot infections from when people are really a little too aggressive on a callus. They get a cut and then they get their foot put back in the water. So that's kind of a no-go too. What we use in my spa is we actually have more of an enzyme kind of debrider. So we use like a urea product, and then it's just a disposable light pumice. So once you leave that kind of a product on for a while, that helps soften up the skin enough that you can just use a light pumice without worrying about tearing up, and making little cuts in the skin. So that's
right now we're talking. So right now we're talking about the back of the foot where they use that cheese grater to get all the hard
like along the heel.
Okay. So you're saying that in some cases that can be okay if they're not as aggressive with it and they don't create a cut. But you use an enzyme, you dip the foot in an enzyme solution?
Yeah, usually it comes in like a gel form, and so our tech will just kind of put the gel with, a nice warm wrap like on that area and leave it sitting for a while she does other parts of the pedicure, and then like come back with just the light pumice stone and that gets thrown out. So yeah.
Oh wow.
Yeah.
Wow. Okay.
Yeah, I know. I think then the next big thing is if you do get cut, do not put your foot back in the water. Please don't.
Okay.
Just don't let anybody else do it to you. It's not a good idea. Okay. And then ingrowns. That's the other one that I hear all the time, that people like go in specifically to have their ingrowns removed. Yeah. I mean, I trust my tech to take care of like little ingrowns. So if it's just like out at the very, very tip of the nail, probably okay. Like, that's not a big deal. But if it's like an ingrown all the way down that border, like, you need to see a podiatrist because, like, for
Okay.
one, I mean, we might be able to do something about it more permanently so that you stop having to deal with this altogether.
Okay.
But two, like, yeah, you just don't want anybody, digging at you with tools that, like, you're just not positive or completely sterile and clean. I get a lot of fungal infections and foot infections from that specifically. Like, went a little too far for the ingrown, bled a little bit, and then went back in the water. It's
Okay.
no bueno.
Okay.
So that's just kind of something to watch for. But yeah, I mean, it really, like, pedicures can be super beneficial for, like, your circulation, your nerve sensation. I love having it for some of my patients, but we just have to be really careful, about cleanliness and safety. Those are the two big things.
Wow. Okay. Mostly because I love my nail salon where I get my pedicures done.
Yeah.
And I love my nail lady.
Yep.
But now I think I gotta make some demands.
Well, yeah. And what I tell people when they're nervous about it, because, I understand, like, we run a spa that, because everything's, surgically autoclaved and it's, like, really high level of safety and care, it does cost a little more because we have, like, higher level products. I don't use products that have any salicylic acid, which is another thing that's really common with places. So we may be above price point for some people. Totally get that. So my thing for people, if they've got somebody they really love, is, there's nothing wrong with, like, bringing in your own tools. Like, just bring in your own stuff, and if you're worried about your nails getting cut, go ahead and do the trim up a little bit, to begin with. Let them do the filing and the buffing, have your own tools that they use. And then, the whole point that we all love is the massage anyways. So, like, you go get a massage, Don't let it stop you from doing it, but maybe bring your own stuff.
Okay, that's a great idea. That's a great idea because I have an autoclave too.
Yeah, just sterilize your stuff, girl. Like, don't worry about it.
But for people who don't have an autoclave, they can look for making sure that the tools that they're using is coming from a fresh bag that has been sealed and is just open for the first time. Thank you for that. That's awesome. That's awesome.
Yeah, absolutely.
Yes. So if someone has diabetes or other medical conditions, is it safe for them to get a pedicure?
I tend to hesitate a little bit on that because there are things that can happen when you have diabetes in the foot, especially. Mostly it's that we don't heal as well when there's an elevated level of sugar in the blood, right? So if you get cut, if you have any even micro cuts, like, you're just going to be more prone to the normal skin bacteria getting in there and causing a problem and getting an infection. So, one of the things with diabetes is that soaking your foot for longer than about 4 or 5 minutes does tend to cause little micro cuts in the skin. And that goes for everybody. But when you have diabetes, that can be a little more dangerous. So, a really, like, truncated soak time, unfortunately, for people is probably, going to need to be considered. And then the other thing is, on a diabetic, you really don't want to have those cuticles cut down. Like, that's another avenue for infection. So, if you're comfortable kind of doing it a little bit at home with your own tools, maybe, but you want to be really kind of conscious about that. We handle a lot of diabetics in the spa that I have, but I know with the training from my technician that she knows what she can do, she knows what she can't do. And a lot of them just come in to see me first. I take care of their nails and everything, and then they go in and get everything all buffed up and happy by the tech,
That's nice.
Yeah.
Right. Okay, so the cuticles on the toes, not to cut them down too much.
Yeah.
Too thick.
Yeah, if they're real long and you get them sliced back, pushed back and it's really thick. Yeah, you can have some of that cut, but like, every time.
Okay.
Yeah.
And don't soak your foot for more than 4 minutes, 5 minutes.
4 to 5 minutes. Yeah, that's it, unfortunately.
Okay. And I had a question, I just lost it. That's okay. What about toe fungus then? How is that managed?
Toe fungus is hard. So toe fungus, actually, what gets underneath the toenail is like the normal fungus that lives on your skin anyway. So everybody has fungus. Like,
Okay.
get it out of your heads that you're going to get rid of it somehow. That's a futile fight.
Okay.
It's on your skin just like your normal bacteria. The problem is when you like stub your toe into something and you get a little lift in the nail, and fungus loves it warm, dark, and damp. And under the nail fits every part of that desire. So as soon as it like that happens, you kind of have a big vacancy sign go up where the fungus is like, oh, hey, check this out, you know? So it gets underneath there, and then it lives on the nail bed, and it starts to make all of this like discoloration and debris and like thickening up the nail because it's basically trying to block out the light. So it's really hard when you get toenail fungus, if it's yellow, that means it's the underneath kind, and it's like it really, the stuff you put on the top just can't really get down in there. You can try with some of the topical stuff. If you're going to do it, I always recommend kind of filing and buffing the surface of the nail to kind of help make pores so that it can get in there a little bit better. But even then, it's not a great, a great solution. So if you find that that's happening, I highly recommend going into a podiatrist or somebody that specializes in that. Dermatology can help too. They just sometimes don't really like to deal with the toenails, which I get. So they usually send them to me, at least in my area. But, your dermatologist might be able to help you too. But you want to go in and actually see a professional about it and not just ignore it, because it will spread through the whole nail. And then you're going to have one of those like giant thick nails that you see online. That gets real hard to treat. So, but prevention really, like if you prevent it, you'll be good.
Okay. So to recap, make sure the nail salon is sterilizing their tools.
Yes.
Make sure that if they're doing that cheese grater on the back of your foot, that it's not aggressive and it doesn't create a cut.
Yep.
If you do get a cut, do not put your foot back in the water.
Correct.
What you can do is bring your own tools.
Yes.
You can clean your own tools yourself. They're just used for you. So even if there's fungus on it, it's yours.
Yep, it's yours. That's all it needs.
And if you're diabetic, then you don't want to soak your foot in the water for more than 4 or 5 minutes, and you don't want to put your foot back in the water. You don't want. Wait, was that 2 things for diabetics? You don't want to file the cuticles. You don't want to file the cuticle. Okay.
Yeah.
And toenail fungus, just go see a podiatrist, because if you ignore it, if it keeps getting thicker, then it's harder to treat.
Yep. Well,
you got it. Thank you.
That was the whole thing.
You. That was excellent. Thank you so much.
You are so welcome.
All right, Dr. Sarah, how can people connect with you? Where can people find you?
Sure. I mean, we have our spa. If you're in the Western Washington area, we're up in Silverdale. It's called Pure Peninsula Spa, and our website is purepeninsulaspa.com. If people are looking to connect with me, probably the better way to do it would be at Dr. Sarah VPS, so DrSarah, and then V for Victor, P for Peter, S for Sally, at gmail.com. And that's my coaching. So, that's pretty easy email to get a hold of me.
Okay. So that's for physicians who are trying to start their practice.
Yes.
Coaching for that.
Yeah, I basically specialize in the startups. That's
okay. That's awesome. That's awesome. Do you have a YouTube page, a Instagram page, anywhere you post information for people?
Yeah, we've got the Instagram page here. That's at Dr. Sarah and then Neitzel, my last name, Neitzel, which you can find on here. And then we do have a Facebook page for Pure Peninsula Spa if you kind of want more information about, spa tips and stuff like that.
Oh, perfect.
Yeah.
Pure Peninsula Spa. I'll post that in the comments when I repost the live.
Yeah, hopefully it's helpful for everybody.
Yes, this is so fun. I certainly know, because I love my lady, but I don't think that they do all the things that you mentioned. And it's, miracle that I haven't.
Yeah, and like sometimes you get lucky for years, and then it just takes that
one time. You're right.
Yeah, so
you're right. I'm gonna make some changes.
Yeah. So, well, thanks. I hope it was helpful for everybody.
It was. Thank you so much.
No problem.
Have a wonderful rest of your day, and don't work too hard on the farm.
I'm gonna try not to. I'm gonna try to relax a little today. All right. Thanks for having me. We'll see you guys later.
Take care.